everybody, and welcome to Gnyp Gnop. It's another Friday here in lovely Windsor, and
rainy Windsor.
Let's just say it's a little bit cloudy today. It's one of those kind of days, but it's cooler.
It is.
Actually, I got to be honest. I've been enjoying the new, like the nice warmer weather, but as we're getting closer to Halloween, I need a little bit of a cooler temperature, just because it just doesn't seem right to be.
It doesn't.
Like
it doesn't.
28, 29 degrees and being, or like the 80s, you know what I mean? And going trick-or-treating. That's what they do down south, and this isn't south, I tell you.
Yeah, and we traditionally have always bought our pumpkins in September.
Yep.
And left them outside as decoration for outside. They've all turned to liquid.
Yes, I know, it's crazy.
So, no more heat, please. No more heat.
No, I'm done with the heat right now. So, I'm Greg Gnyp. So, of course, I'm the Gnyp side of the Gnyp Gnop. That's Chris Yasinski. He's automatically
the Gnop.
The Gnop. So, you know what? Okay, just before we get to our guest.
Yes, our special guest.
I was very special. I was actually watching American Dad.
Okay.
And there's a scene where Steve gets really all upset, and he mentions Gnyp Gnop. The son mentions Gnyp Gnop, and I was like, "Oh, that's great!" It just made me excited. little things make me excited. So, well, I guess what we should tell everybody, we've got a very special guest on the show today, because about a week and a half ago, we lost a friend to a heart attack. One of our favorite musicians, Pat Fish, with the Jazz Butcher Conspiracy, to a sudden heart attack. Now he had been sick, and he had battled some illnesses. He talked about his sleep apnea, things like that. But it was a sudden heart attack in his sleep that ended up being the cause of his death. So you thought it would be such a great idea.
Fantastic idea. I've got this perfect guest.
And you said you say you trust him.
Trust him. He's been my cardiologist for like a decade. His name
you should bring him on.
I will. It's Dr. Wadia Tarhuni. He's the president and CEO of the Windsor Cardiac Center. Welcome, Wadia, to the show.
Oh, thanks, Chris. Greg. Pleasure to be with you.
Yeah, it's great to see you. So,
I bet you it's great to see him this time and not be like hooked up to all sorts of monitors.
Seriously.
There's an issue that you and I have talked about over the last 10 years at least, about sudden cardiac incidents, and it's with runners and with running, and this is the marathon season. Even though it's kind of COVID and marathons are smaller, marathons will still make the front page somewhere in the world when a runner dies of a cardiac incident. And it always happens because it's kind of like the law of numbers and the law of averages. But these are people who die of issues that are not diagnosed.
Yes.
And that's the issue. So
absolutely. And the thing, Chris, is unfortunately, this is a preventable death. As you know, sudden cardiac death is a major problem, and especially in athletes and also in the young people. But actually, we know that most of the sudden cardiac death can be predicted. What I mean by that, 90% of the heart attack can be prevented if you diagnose them early. For example, in patients who have diabetes, family history, hypertensive, sleep apnea, by the way, the first symptoms of heart problems is sudden death, 50% of them. So if you have a patient with multiple risk factors, sleep apnea, overweight, strong family histories, diabetes, hypertensive, high cholesterol, if you wait for this person to come to your clinic or to the emergency room with the chest pain, you're not going to get him. 50% of those people will come the first presentation, sudden cardiac death. And that's why me and you, Chris, have been talking about this for for almost a decade.
Yeah.
We need to be proactive. You need to see your doctors before you start having symptoms. Know my numbers. We did a campaign about maybe 5-6 years ago. Know my numbers. Every person should know what's his number. Same like when I ask you, Chris or Greg, what's your phone number? You know your phone number. Same thing. What's my number? What's my blood pressure? It should be 120/80. What's my cholesterol? It should be less than 3 or 2. What's why my hemoglobin A1C, which for diabetes is 6%? What's my BMI? 25. So there is a very simple number you should remember. And if you don't have them, just go to your family doctor and ask him,
Right.
hey, doc, please check my cholesterol and give me the number. So by having your number, and if your number is out of whack, which means that it's a high blood sugar or diabetes or things there, so it's a flag, it's a red flag, and you can actually see your doctor, start medications, and bring your number back to normal. So by doing this, you're able to prevent heart attack 90% of the time.
Right, right. You know, it's sudden cardiac incidents, right? It's a sudden death.
Yes.
Half of people who have a heart attack, their first heart attack, die.
Yes.
That to me is an outstanding number.
Yeah, but those people, high risk, diabetic patients, is not normal patients. So if you have multiple risk factors, if you don't have any risk factors, your first symptoms of heart problem is maybe chest pain.
Okay.
But if you have multiple risk factors, especially diabetes, because diabetes actually have silent ischemia. You don't have a pain because of the blood sugars were eating up your nerve and you don't feel them. That's why they have a problem. Bit sore. That's why having leg sore. You don't feel the pain. So that's why they have some leg injuries.
Right.
So diabetic patients, specifically diabetic patients. That's why we have in Windsor here, we're leading actually the whole countries starting diabetic cardiovascular screening programs. Any diabetic patients over 40 or 45 should have stress echo, where we're able to do the stress test, make sure there's no blockages.
Right.
So the message I'm trying to get to our audience is, if you have high risk, which means that you have high blood pressures, diabetes, smokers, family history, overweight with sleep apneas, family histories, don't wait till you have starting symptoms. If you're 40 above, see your doctors, let him do some blood tests. Let's book you for a stress test, put your heart under stress and look at the heart. And if you identify blockages or a problem, we can fix it before, unfortunately, you present with sudden cardiac death.
Right. Has the issues around COVID, has that changed the numbers for
yes, you? Unfortunately, yes. Unfortunately, as you know, COVID is a very strange disease. We're still learning from this disease, and what we learn that it's affecting the heart by two ways. Number one, patients start having symptoms and they don't want to go to the emergency room because they're afraid that they may have a COVID there. So there's delay in treatment.
Okay.
So patient not present to emergency room early enough, and if they present, very, very late. So that's one of the problems. The other problem with the COVID, we know this strange disease make the blood very thick. So if you have very thick blood and make blood clot,
right,
it make the patient more prone to have stroke and heart attack. So COVID affecting us by two ways: delay the diagnosis and make the heart attack come sooner. And that's why, especially with these days, it's very important to be proactive and try to listen to your body and try to do a preventive measurement by seeing your doctor and know your numbers.
Okay. Greg?
No, one of the questions, we were talking about like sudden death and things like that, and with athletes. So recently, it was during the World Cup, the young player from I want to say he was from Finland who collapsed on the field, and they said if it wasn't for the doctors that was
yes.
around the field, he would have died on there. Here, but my question is, you hear about athletes at the age of 21, 23, 24 dying on the field, on the basketball court, things like that. What causes that? Is that something that just was missed by doctors, or is it something that doesn't present itself? Then it's all of a sudden one day the heart just goes, surprise, it's here.
Yes, absolutely, Greg. The most common cause of sudden cardiac death in athlete actually is a congenital. The heart, something wrong with the heart. You're born with that. The heart muscle is thickened. He has some problem with the valves. He has some problem with the electricity of the heart. And this can be very, very easy detected by doing simple ultrasound of the heart, as well as stress echoes. As well as we pioneering the real-time heart monitor cardiophone, and we did that with the press. Actually, what we do for those athletes, actually, we give them a real-time heart monitor, let them to walk, run, and we monitor their heart real-time for about 1 or 2 hours, and then for 6 hours. Sometimes your heart perfectly well at rest, nothing wrong with it. But when you get that athlete to run in the competitive sport, you see something abnormal. So the bottom line is that those young athletes have something wrong with their heart hidden, and you cannot see it unless you put the heart under stress. So they need a special cardiac test, which include 2D echoes, stress echoes, and real-time cardiophone. So by doing this, you're able to look at the heart 360 degrees at rest as well as during exercise. Now, the other point is very important is the early cardiopulmonary resuscitation, CPR. It's very, very important. That's the reason why that Finland athlete, thanks God, survived. Because once you have sudden cardiac death, the clock starts clicking. Every 1 minute delay, you increase your death by 10%. Wow. So basically, if you wait for 10 minutes, it's over. And that's why it's very important to enable the public, what's called public access defib. And we started that, and hopefully after COVID, we're going to do more of this one. We're trying to teach the public, the general people, because we know that up to 70% of sudden cardiac death happen outside the hospital, outside the medical facility. So there's no point to train the doctors and the nurse because you catching only 30% of the problems. We need to go out to the communities, to the public, teach them simple how they can do the CPR quickly within the first 2 minutes from the cardiac arrest, and also enable them with the device called automated external defib, where he doesn't need to know anything about, just get the defib, both in the chest. They have artificial intelligence, the computer will analyze the rhythms. If they have problem with the heart, VTAC or something, they give him automatic shock. So I think the sudden cardiac athlete is a major problem, and we can solve it by 2 major things. Number one, be very meticulous in screening all the athletes using their resting and exercising and real-time heart monitor during exercise, as well as teach the public how to perform high-quality cardiopulmonary resuscitation and enable them to have external defib.
That's great. Wadia, thank you very much for all your time today. I know how busy you are. Thanks for coming on with such short notice and kind of giving us the 101 on heart health. It's very, very important. You know how passionate I am about doing this with you. It's been a great journey, and you're such a great doctor doing it. Thank you very much.
Thanks, Chris. Thanks, Rick.
Thanks, Doctor.
Thank you, Doctor.
Bye-bye. Thank you. Bye-bye.
So, I've known like Dr. Tarhuni, I got to tell you, for well over a decade. And, there's a reason why. So I got to tell you, our company was the first company that ever owned defibs on courses. And I started that about 10 years ago, where we started actually having defibrillators with our crew, not just with our medical staff. And the other thing that's really important is when he was pioneering, they call them loop monitors. If you go to any other cardiologist, it's like a little recording device. It looks like a pager you hang on with 2 leads that come off your heart and kind of records all the electricity going on through your heart. He pioneered ones that look like cell phones and are hooked up to cell towers and going back to his office with cardiologists looking at it. Cool. So what we did was we actually had all of our marathon runners one year. It's like 200 of them where the option was, hey, you're running the marathon today. Would you like a free once in a lifetime, 3, 4, 5 hour EKG test of your heart while you're performing a marathon?
Right.
And what's really surprising about that is it gives a different type of data, right? Because people say, oh,
sure.
I thought I had an issue. I went to the cardiologist, but they can't find anything. Well, no shit, they can't find anything because you're in peak performance right now, and your at rest heart rate is like 40. Like, I mean, you're in great shape, and that's the problem. It kind of gets hidden. So, but now you can bring back the entire disk of all the data from the race. Here you go. Give it to your cardiologist and have them go through it. And we had one person who ran the race. And we found the cardiac issue for her, and she's been grateful ever since. And it's pretty rewarding.
Yeah, that's incredible. And when he was, I have to say, when he was talking about stress tests, I gotta be honest, so I had an issue that they sent me to one of the fancy stress tests a couple of years ago, and I'm terrified of doctors. Like, flat out, I've got white coat syndrome. Like, my blood pressure goes through the roof when I at home. I'm absolutely terrified of the doctor.
Dude, I saw 3 doctors already today, including Wadea just now, and I have most of them on I just text them, and it's like, dude, what's going on?
Yeah, see, on my family doctor is a family friend.
Yes.
And when I see him face to face, like in social situation, love him. I go to his office because I have an infected fingernail or something like that. And I can feel my heart. My heart's at 135 beats per minute.
Wow.
It's like, oh yeah, terrified of him, right? So I had to do my stress test, and it was great because you're on the treadmill, and they're like, listen, we got to get your heart rate up to 144 beats per minute, and I'm walking fast, and then I'm jogging a bit, and the best part was, because they keep asking you, do you have any chest pain? Do you feel out of breath? So all of a sudden she goes, look at that. You're at 148 beats per minute. This is great. Can you keep going? And I said, sure. She goes, do you have any chest pain? I went, no. She goes, are you out of breath? And I said, oh God, yes. Look at me. I'm old. I'm fat. And I'm running on a treadmill. Of course I'm out of breath. And she's like, and I'm like, but I can keep going.
Wow.
Yeah.
That's awesome.
Yeah, it was like, it's like, are you out of breath? Look at me. I'm running. Yeah. Of course I'm out of breath.
So this week you got to meet my cardiologist. Next week we get to meet Greg's proctologist.
His name is Dr. Finger. Yeah.
How big of an asshole really are you, Greg?
Well, I actually pointed that out last night to somebody. I said, the general, right? I'm not even going to go there.
All right, that's fine. That's fine.
Okay, yeah. So today I was up early today. I decided I needed to do a little shopping, and I got myself actually some new bed linens. They were on sale.
Ooh.
And because I'm kind of lazy, sometimes I don't really like doing a lot of laundry. So I'm like, I'll just put the clean one. I'll put these ones on already.
Egyptian
and I was
cotton?
reading the pillowcases, and it said, do not iron. And I'm thinking to myself, like, yeah, like that was going to happen anyways. It's like,
yeah, right.
I'm like, there are some things Daddy doesn't do.
Yeah.
Iron his bed sheets.
Yeah. Yeah.
Yeah.
Yeah. Just to kind of switch topics a bit, I was coming back from the doctor's this morning, and I had Kira with me, our Greyhound, and I thought, I'm going to take her for a little walk because the rain was kind of stopping. So there's this a great park in Amherstburg along the waterfront called the Navy Yard Park. It's like a total squirrel orgy out there. There's, if you don't count 20 of them, then you're just not counting them. And it's a great way to kind of bring her out there to help train her. And I ran into a couple who I've kind of known on Facebook and have listened to this show, and Luann and Lee, and they both own Greyhounds. And it's really kind of funny. And I don't know, you can probably agree with this or disagree with this, but you see people that have the dog that you have, and you could be in a wholly different country, and you go, oh, we could be friends.
Oh, in a heartbeat. In a heartbeat. Like, it's funny. There's a hairdresser in Windsor by the name of Danny Bob, and I'm great friends with him and Mark, and because of Sasha, their Cavalier. I've got 3 Cavalier King Charles Spaniels, and he posted on Facebook one time. He's like, does anybody know the gentleman that walks with 3 Cavaliers in the downtown? And everybody went, Greg Gnip. It's like, but it's true though.
Yeah.
But okay, but do you find just in general though, like if you meet somebody on the street, even if it's not a Greyhound, it's whatever, a Maltese, you're like, I can still be friends with you because you've got a dog?
No, there's something about the Greyhound culture, and it's really strange because the Greyhound is the cat of dogs. They sleep all the time. They're really sweet. They're much different than a normal dog. Super well mannered, and it's so strange. I don't know. It's something about the Greyhound because the Greyhound's so recognizable, right?
Oh yeah, and the thing is, Greyhounds recognize each other.
Oh yeah. They always sniff their butts all day long. It's
my boy Elliot. His girlfriend is a Greyhound. He likes them taller and fast.
Like some leggy.
He likes some leggy, and it's funny though because she's like all of a sudden there'll be a Greyhound. There's a couple of Greyhounds in the area, and all of a sudden Luna will see another one, and she's just like out of here, see her, and she wants to go to them.
Mm.
So, oh yeah, but I mean, and Greyhounds are amazing. I mean, they're just a beautiful dog.
So I have a former racer from Ireland, right? She raced like 35 or 36 races, won 8 or 9, I can't remember. And she's 6 years old, and we got her about a year ago. And the folks that I met this morning, Lee and Luann, they have a courser who's 11 years old from Ireland as well. Now, coursing is a sport. Calling it a sport is a blood sport is really an odd thing. I don't know if you're familiar with coursing, Greg.
No.
You're in a farmer's field that is fenced off. It's a couple acres in size. Someone throws a rabbit in at the end of the farmer's field, and then they release 2 greyhounds at the top of the field, and they're at it. It's called coursing. It's disgusting. It's horrible to see and watch. It is something they do in Ireland, but it's one of those pastimes of kings and monarchs and stuff like that. It's like, I don't know, 600 years old, whatever. But anyway, the dog's a former courser. So in Ireland, there's kind of 2 tracks for Greyhound. One's racing and one's coursing. And then the other dog, a real doll, is a meat market dog from China that they rescued. And, every meat market dog I've ever met has always been just wonderfully happy. And it's probably the whole, I'm not somebody's dinner tonight.
Well, and that's what I always, it's so funny you say that because in our neighborhood, there's a young couple that have a meat market Greyhound. And, like I see the racers, and they're so well trained because they were, let's be honest, they were just property.
Sure, they're a machine. Yeah,
and they were meant to, they knew to always stay close to the trainer, all this kind of stuff. And then there's this meat market dog from China, and she bounces everywhere. She's hopping like this. You watch the racers, and I don't want to say they plod, but they're very.
That's right. No,
they just kind of go in the.
There's a mannerism. They're very, very well mannered. It's unbelievable how well mannered those dogs are.
This meat market dog bounces off the walls, kind of like, look at me. I'm not going to be in a pot today. And it's like, but I got to be honest. I think it's awesome. I mean, they're such brilliant dogs.
They really are
beautiful. And when people say, well, they're so big, I'm like, yeah, they're big, but they don't do anything.
Yeah, 22 hours a day, they'll be laying down and sleeping.
Yeah, well, right. Well,
100%.
Luna across the street, the one time she's a little bit nervous with the storms. Like my dogs could care less. Thunder, lightning, fireworks, gunshots, backfired cars, and they just go, meh, whatever. Luna, on the other hand, she when it's raining and things like that, and I think the one time they had to actually kind of almost drag her out of her crate because she was there for like 17 hours. And they're like, listen, you got to move and pee once.
Yeah.
And she's like, no, I'm good here. I can stay.
They are stubborn. Oh boy, Greyhounds are stubborn.
No prostate problem there.
Anyway, hey, the border is going to be officially open to Canadians.
November the 8th?
Yes. Isn't that wonderful? The White House announced this morning, November 8th is the date for opening up the borders. And what's unique and interesting about this is that there will be no PCR test required, and there will be no test. It's just you have 2 vaccinations. Yes. Can you prove it immediately? No. Okay, then you go in a secondary and deal with it. But there is no testing. Like in Canada, Americans have to come over with a current PCR, and they also have to do the rapid test at the border. Right. Apparently, the Americans are not going to build that infrastructure because they have 2 massive borders on either side of them, and they're not willing to build those infrastructures in place.
And if I'm not mistaken, right now, Moderna, Pfizer, and AstraZeneca have all been approved for crossing.
Yes.
They're still talking about the whole if you mixed your vaccines.
Yeah, so the rumor that I had heard was the mixing of the vaccines is pretty much fait accompli. They're going to let it go through anyway because they were mixed with basically everything that was already approved. So it was just an approved cocktail is the way they're going to look at it, even though they never did that in the United States. We did that in Canada. Other parts of the world did it. I have AstraZeneca, which I'm really happy to see that the Americans, who are the official largest contributor to the World Health Organization, are finally listening to the World Health Organization and approving AstraZeneca into that list.
Well, that, yeah, and the other thing is, I got to be honest, and it's going to sound weird the way I'm going to say this, because I spent so much time in the United States. Now it's been 19 months. I'm kind of like, I'll get there again. Like I'm like, just as soon as the border opens doesn't mean I'm going to go rushing over.
Oh, come on, let's go.
Yeah, no, it's kind of weird. It's kind of like I'll get there. But I'm going to wait. I think I'm going to wait for the first initial couple of weeks, just for the simple fact that there's going to be so many people rushing over. And I think that's what I mean. It's going to be like, listen, there's going to be like that mad wave of people wanting to go over. Lineups are going to be horrible. So I'm going to be like, you know what? I'll just wait a couple of more weeks. I'm good.
Yeah. I'm looking forward to it.
I have to go over and get my Dunkin' Donuts coffee. I have very little left.
Oh my God! How much did you have that lasted you 20 months?
I'm very lucky that I have a couple of friends who work in the States.
Oh,
so they would bring me back Dunkin' Donuts coffee.
Oh, contraband.
Yeah, it was smuggled in.
All right, man. All right. So hey, next week, you're proctologist, right?
Yeah, my proctologist. You'll hear this.
And a slap of the gloves. Here we go. Have a good weekend, everybody.
All right, buddy. Everybody be good. Healthy. Stay healthy.
See you, Greg.